Good day, ma'am. I'm Krishna Tayo po, your nursing aide for today. And today, I'm going to perform pulse continuous irrigation and open intermittent irrigation. So, the purposes of this procedure is um, to maintain the patency of urinary catheter and tubing, and to free blockage in a urinary catheter tubing for open intermittent irrigation. Then for assessment, determine the current urinary drainage system, review the client record of recent INO and any difficulties the client has been experiencing with the system. Then review the results of the previous irrigations. Then assess the patient for any discomfort, bladder spasm, and distended bladder. Also check the patient's record for open intermittent, the physician's order, type of irrigating solution to be used. Then if patient is received continuous or intermittent flow into the bladder, frequency of irrigation, type of catheter to be used. Then assess the following: color of urine, the presence of mucus or sediment, patency of drainage tubing, closed system, note if fluid entering bladder and fluid draining from the bladder are appropriate proportions. Then review INO record. Then for planning, before irrigating a catheter or tubing, we need to check the reason for the irrigation, the order authorizing the continuous or intermittent irrigation that has most agency or primary care provider's order is required, and the type of sterile solution, the amount and strength to be used, and if continuous, then the type of catheter in place. Also develop individualized goals of the care for patient based on nursing diagnosis, maintain patent free-flowing urinary drainage system, minimize risk of infection, minimize discomfort, and explain the procedure to the patient. For next, for implementation, first we need to follow the policy and procedure of the hospital or utility. Then prior to performing the procedure, introduce self and verify client's identity using agency protocol, as his name, or if he is conscious, but if unconscious, as the relatives, check the hospital bracelet, or check the chart. Then perform hand hygiene and observe any other infection prevention procedures. Then provide privacy to the client by closing the room curtain or the door if possible. Then gloves. Next, empty, measure, and record the amount of appearance of urine present in the drainage bag. Because emptying the drainage bag allows more accurate measurement of urinary output after the irrigation is in place or completed. Assessing the catheter of the urinary or urine providers baseline data for the comparison. Afterwards, discard urine and gloves.
Ito mo kayo may asawa niya ito. Si Gia.
Next, prepare equipment. So, perform hand hygiene.
Happy 8 months.
Then, we are going to connect the irrigation infusion tubing to the irrigation solution and flush the tubing with solution, keeping the tip sterile. And flushing the tubing. Next, connect the we are going to this step, flushing the tubing, is done to remove air and prevents from being installed into the bladder. Then, apply gloves and cleanse the port with antiseptic swabs. After cleansing, connect the drainage bag and tubing to the urinary drainage port if not already in place, but in my case it was already connected. And remove and discard gloves, then perform hand hygiene. The next, irrigate the bladder. For close continuous irrigation, using a 3-way catheter, open the clamp on the urinary drainage tubing if present. Then, because this allows the irrigating solution to flow out of the bladder continuously. Then, apply clean gloves. Next, open regulating clamp on the irrigating fluid solution to flow out of the bladder continuously. Then next, we're doing it to regulate the prescribed rate, which is 40 to 60 drops per minute if not specified. Then assess the drainage for amount, color, and clarity. The amount of the drainage should equal to the amount of the irrigant entering the bladder plus expected urine output. Then next, we're going to empty the bag frequently so that it's not going to exceed half full. And for And next, for close intermittent irrigation, we need to determine whether the solution is remain in the bladder for a specified time. Then if the solution is to remain in the bladder, so close the clamp to the urinary drainage tubing, because closing the flow clamp allows the solution to be retained in a bladder and in contact with bladder walls. Then, if the solution is being installed or irrigate, so the catheter open the flow clamp on the urinary drainage tubing, and because irrigate solution will flow through urinary drainage port and tubing, removing mucus and shreds or clots. Then if the three-way catheter is used, we need to open the flow clamp to the irrigating fluid solution tubing to allow the specified amount of solution to infuse, then close the clamp on the infusion tubing. And next, assess the client and the urinary output. We are going to assess the client's comfort, if he is comfortable or he is not comfortable, felt irritated or some pain in his lower abdomen or bladder part or genitalia. Then we're going to apply gloves, then empty the drainage bag and measure the contents. We are going to subtract, the amount of ergant instilled from the total volume of the drainage to obtain the volume of urine output. And afterwards, we are going to remove and discard gloves. And perform hand hygiene.
Pag huminga ka ba mo?
Next, for open intermittent irrigation, first we're going to follow the policy and procedure of the hospital. Then assemble the equipments, use an irrigation tree or assemble individual items, tubing such as clean gloves, disposable water resistant towel, sterile irrigation solution, sterile basin, sterile irrigating set, sterile 20 to 50 ml irrigating syringe, then antiseptic swabs, and sterile protective cup for catheter drainage tubing. So next, prepare the client. After preparing the client, perform hand hygiene. Using aseptic technique, open supplies and pour the irrigating solution into the sterile basin or receptacle. Using aseptic technique is vital to reduce the risk of instilling microorganism into the urinary tract during irrigation. Then place the disposable water resistant towel under the catheter. So this one. Next, apply clean gloves. And next, we're going to disconnect catheter from drainage tubing and place the catheter end in the sterile basin. And we are going to place sterile protective cap over end of the catheter, the drainage tubing, this one. The end of drainage tubing, make sure not to touch into the edge of the bed or into the basin, because it is contaminated, considered contaminated if it will touch. Then next, draw prescribed solution for then maintain the sterility of the syringe and the solution, then irrigate the bladder. So we're going to insert the tip of the syringe into the catheter opening. And next, gently slowly inject the solution into the catheter, at least 3 ml per second. Inject slowly. It's about 30 to 40 ml generally instilled for catheter irrigation. 100 to 120 ml may be instilled for bladder irrigation or installation. Then gently install, maybe reduce the risk of injury for bladder mucosa and bladder spasm. And remove syringe and allow solution and drain back into the basin. And continue to irrigate the client's bladder until the total amount to be instilled has been injected, or when fluid returns are clear and clots are removed. Then next, we are going to remove the protective cap from the drainage tubing and wipe the antiseptic. We are going to wipe with antiseptic swab. And we are going to reconnect the drainage tubing. Then next, we are going to remove and discard gloves. And perform hand hygiene. And for evaluation, so perform detailed follow-up based on findings that deviated from expected or normal for the client. Then relate findings to previous assessment data if available. Then for also we need to assess the drainage for the amount, color, and clarity. The amount of drainage should be equal to the amount of irrigant entering the bladder plus any urine that may have been dwelling in the bladder. Also determine the amount of the fluid used for the irrigation and subtract from total output on the client's INO record. Then we need to assess also the client's and the urinary output and document the procedure. Then for documentation, recording and reporting. So we need to report significant deviation from normal to the primary care provider, record type and amount of irrigation solution use, amount return as drainage, and the character of drainage. Also record and report any findings such as complaints of bladder spasm, inability to install fluid in bladder. Also document findings in the client record using forms of checklist supplemented by narrative notes when appropriate. Then note any abnormal constituents such as blood clots, pus, or mucus shreds. Then also we need to document the amount of solution used as irrigant, amount returned as drainage in nurse's notes, and the INO sheet. Then report catheter occlusion, sudden bleeding, if there is bleeding during the procedure, infection or increased pain to the physician if it's observed or it was adverse reaction from the client during and after the procedure. Then we make sure to check the drainage bag, the amount, so the amount of urine is 100 ml. Then it was clear and there is no any adverse reaction from the client in the procedure. That's all. Thank you.